born in a revolution. We were born in 1968 when the Vietnam War was going on, the sexual revolution was happening, the hippies versus the military was in people's minds. And in fact, Fan Free Clinic during that time used to help out down with the riots that were going on in the bottom, where they actually had brick streets. And I remember one of the founders telling me the story of when she gave us an armband that said Fan Free Clinic used to wear these armbands when they would go in where the protests were, because people were picking bricks up right out of the street and throwing them. And so people were getting hurt, and who's there is Fan Free Clinic, our band of hippies, if you will, running around with their armbands on and helping folks get some health care around this. That chaotic kind of beginning, that grassroots beginning, is the fire in the belly for the organization. It's the conscience that helped develop our commitment to social justice, our reason for not only continuing to serve, but also to work in the advocacy field for people who need rights in this country who still to this day don't have them. We started as part of the university movement at the time. There was not health care for students being offered, and particularly there was not birth control being offered. And we began kind of as a clinic for students, and then once the doors opened, there began to be other folks who came to see us that didn't have health insurance. So we began serving homeless people, people who were just low income, who had work but couldn't afford insurance, and eventually just became a full-blown primary care in those early years. And then of course, when the AIDS pandemic hit in the 80s and the early 90s, Fan Free Clinic was out front. People were scared to death that they were going to catch an illness. And at that time, you couldn't even find churches that were willing to do funerals. You couldn't find funeral homes willing to embalm bodies. In our history, we have land that was donated to us to bury people. And still on the books, haven't even gotten rid of it now. But one of the things that Fan Free did during that time was to provide, again, a sanctuary for a group of people that society had said, we're scared to death of you, we don't like the behavior you're engaged in, and we're not going to serve you. And Fan Free Clinic wrapped its arms around these folks, and they did it through care teams. They did it through volunteer care teams that would go in and work with HIV and AIDS patients that when they were dying 2 and 3 a week, helping them from everything from preparing meals to bathing them to helping them plan funerals. And of course, many of these folks at that time, their families had also abandoned them. And we had hundreds of these care teams that did this. And the trauma of that alone, just of having volunteers taking care of people who were dying at this rate before the medicines came about, it's just a tremendous part of our legend in this community. And the gay community has not forgotten us for that. We're still very committed to that work. But as time moved on and medications became available, we continued to evolve as an organization as well. And I would say today, besides our HIV and AIDS work, we're still on the cutting edge of the greatest needs of society. Mental health is one of those now. It has been forever, but no one began to really notice it until we had all of these tragedies. And so now, we've been very focused on how do we do good primary care, how do we continue to do good HIV prevention and support, and then also how do we have a good, robust mental health program that helps those, again, least served, get the services they need.
People that come to the clinic are your community. They're people that are educated and uneducated, people that work and don't work, people that have survived incredible tragedy that's hard to imagine surviving. Our patients are really survivors, and they're just like me and you. And it's a great privilege to care for them. I came to the Fan-Free Clinic as a volunteer as a medical student in the mid-90s, and then came back as a volunteer in 2011. And then in late 2012 became the medical director. We don't just have a medical clinic where we see people for chronic diseases and acute illnesses, but we also are able to provide prescription medications. We have a food pantry, we have mental health services, we have HIV testing, we have a laboratory to provide blood work and lab results. Currently, we have over 1,600 patients that we see in the medical clinic for a total of over 7,000 patient visits annually. We also see patients in our mental health area and in the community for our HIV outreach, and overall we serve over 18,000 people in the community through these other venues as well. I think that everyone that practices here does it because they believe that healthcare is a right. The problem of patients being uninsured and people living in low income is still a huge problem, and there's still many people going underserved. So even though we've grown, the problem has grown faster than we have.
Good morning.
For me, one of the biggest challenges at the Fan-Free Clinic is just finding enough time to do everything that I feel the patients need. Quality is incredibly important to us, and we want to be able to get that high quality health care to every patient.
We certainly see the news and media telling us how well people are doing, that the economy might be getting better, but from where we sit, we don't see that. We see a growing need for health care in spite of the fact that they've passed the Affordable Care Act. There's still people who can't afford to purchase insurance, particularly if they have chronic illness. There's people who have lost their jobs because of no fault of their own, because of downsizing businesses and so forth. And those doors to opportunity are just not there for everybody. If you're first coming out of prison, you got to find a place to live and recharge your life again, start over. If you're dealing with a chronic illness or living in a rehabbed facility somewhere, where do you go? You got to have a place to go like Fan-Free Clinic that is able to actually hook you up with other services. Even if we can't provide you certain services, we're there to actually help you hook up with other services to move on with life. It's a matter of caring about people no matter what part of life that they're in. And for anybody who thinks that the world is all well, I'm here to tell you it's not.
Basically, I had to become homeless because that's the only situation where it allows me, where I can walk around for an hour or two, but when it gets bad, I have to be able to literally prop my leg up for an hour or two to let the swelling go down so that I can function further. So, I used to be somebody I could walk for hours and hours and hours, and I could be on my feet for 18 hours cooking and having a good time, and it was never a problem. My feet never hurt, my legs never hurt, and just a simple thing, just one minor health care issue. And I know many people have much worse problems, but this really interfered in my career. I have a degree in culinary arts. I went to Johnson & Wales. I graduated in '96. I paid for it myself, cash. It was very expensive, and I had a really good career going. And I never thought of all things that this is what would take me down.
You probably have somebody that you know. You would never know necessarily they come to our clinic, but I can promise you it runs the gamut of people who come to us for whatever reasons, if it's mental health or they may have been out of insurance. There's people that come to us who have had jobs their entire lives. There's people who have come to us who have brought down over $100,000 a year. They never thought they'd find themselves in some of these positions. All of us are kind of one step away from the next crisis, and so we never know when we're going to be there.
maybe a decade or so ago, I was incarcerated in prison, and one of the things that I had did while I was incarcerated was to start a HIV peer group in Lewisburg Federal Penitentiary. When I talk about it, it's not done in a static, isolated, abstract way. This is HIV, write it on the board, but to talk about, our environment, our lives, society as a whole, how does it play in, you as an individual, as a group in society, and now we're coming down to the bare bones, you, your sexuality, and what you do in your most intimate times with your own life, and making sure that at the end of the day, you're still healthy, hopefully happy, and better off for it. It's always amazing in a scary way how many people just do not know. And sometimes I used to think that maybe it's just because people, shy or just don't want to speak up. You answer, I answer like that. But sometimes I wonder, you're not really knowing or connecting with this basic information. But I would say the vast majority of the people is still lacking this information about HIV. And I guess it's not until a person actually has it, or may have somebody close to them, a significant other that has HIV or even AIDS, that a person becomes even a little bit more informed. But definitely it's still a very important service because it's dealing with the most intimate part of ourselves, for the most part, our sexuality, who we're having, not so much who, but how we perform sex, what are we doing in these closed doors, which is your private business, of course. Now we're kind of like probing into that and giving you advice as it relates to that. And it's very important because it's who you are, in essence. And, but most of the time, people are quite unawares about HIV. Still in here, we're talking 2014. It's kind of scary. Poverty and disease and sickness has become so commonplace among certain segments of society, and we might very well be talking about the majority of society, actually, because the poor are getting poorer, and that base is getting broader, and the rich are getting fewer and fewer there, and just, that separation. It's a really big problem in society that you have, even in Richmond, Virginia. You go downtown, and some of the outsiding communities, on every street corner, there's a person with a sign. It's a testament to people's economic plights and what they're going through.
Those in our society who many other entities would not serve, our doors are open to them. We're open to them because they've been left behind for whatever reasons, whether it's poverty, whether it's sexual orientation, whether it's illnesses that no one wanted to treat at a certain time in our history, or whatever reason that we have found convenient to not treat people in our society. That's who Fan Free Clinic is, that's how we started, and that's who we are today.